Hello and welcome to OffBlueMedical. Today we will discuss 5 medical conditions for the USMLE where the best treatment is doing nothing. The first condition is the pediatric conditions of breath-holding spells and sleep terror disorder. Breath-holding spells occurs in children 6 months to 6 years, and it's triggered by emotions, sometimes by trauma, pain, frustration. The child presents, they will be crying and then they hold their breath, they become bluish, cyanotic, and then they lose their tone, and then they get up and are totally normal. So the parents might be terrified. They tell you, what do we need to do? You just tell them, be reassured, you don't need to do anything, and this is okay. Sometimes this may be associated with iron deficiency anemia, but not all the time. The second part is going to be the sleep terror disorder, which is common in childhood. This occurs during non-REM sleep, and the child has complete amnesia of the event next morning. They wake up at night, let's say they wake up at 4 a.m., they come to you, they scream, and they are completely terrified. The child is terrified, and you try to reassure them. They keep crying, and then they go back to sleep. And then the next day, they don't remember anything. So this is sleep terror disorder. How they usually bring it up is just like this. You hear a child screaming at 4 a.m., you go to them, and they keep screaming and crying, and then they go back to sleep. The next day, they don't remember anything. This occurs during childhood. The second condition is the subconjunctival hemorrhage. They bring up an image like this one, just like this one, and it looks scary, but this is benign, and it resolves in 1 to 2 weeks without any intervention. The third condition is the Gilbert syndrome, which occurs in young adults. You see a mildly increased indirect bilirubin level. So there is a mild unconjugated indirect hyperbilirubinemia. The episodes are brought on by physiologic stress, including acute illness, fasting, dehydration, strenuous exercise. Sometimes they mention a patient who is a student and they have exams and they are very stressed. Sometimes they say a patient had a mild flu illness. This occurs because of a congenital reduction in glucocuronidase transferase, specifically UGT1A1, and because this enzyme is the enzyme that's responsible that converts indirect bilirubin to direct bilirubin, and it's deficient, so indirect bilirubin is going to go up. Indirect bilirubin is going to go up. So basically how it happens is that you have the indirect bilirubin. This gets converted to and conjugated to direct bilirubin. By which enzyme? By this enzyme, UGT1A1. And because it's deficient, this is going to go up, and this is going to be the Gilbert syndrome. Treatment is going to be nothing, because it's normal. They might be yellowish, the patient might have jaundice, but that's normal. You don't need to do anything. The fourth condition is the benign murmurs you see in asymptomatic children or adolescents. They will have no chest pain, no palpitations, no dyspnea, no syncope, and there will be a negative family history for sudden cardiac death or congenital heart disease. The murmur characteristics, and this is important, it's that it's a low intensity, so it's not a grade 4, it's not a grade 5, it's going to be grade 1, 2, maybe 3. Low intensity systolic ejection murmur, which is best heard at the left sternal border. With maneuvers, the intensity decreases with reduced venous return. So if the child stands up or does the Valsalva maneuver, they strain themselves, then intensity decreases because of a decreased venous return. And the last condition is going to be the simple febrile seizures, where you see a child with fever and then has a short seizure, which is usually less than 15 minutes, and then they return to baseline. What you tell the parents is that you just need to give the child antipyretics and you just discharge them and reassure them. They might be scared. They might tell you, what if the child has Is the child at risk for epilepsy in the future? And the answer is going to be no. This is a simple febrile seizure. More simple febrile seizures might happen, but that doesn't mean that the child is going to have future epilepsy when they grow up. So there are many other conditions and many other diseases, simple ones that you don't need to treat. So recognizing when not to treat is just as important as knowing how and when to treat.